femoral cuts, and then we sort of get out of the way and it's business as usual with the implant stuff. So there's one tray of instruments here, and then this navigation unit and 2 batteries come in a disposable sterile peel pack. This is your sort of per case charge aspect of the system, disposable. And this will pair with a sensor that's in the tray. And these guys will be communicating with one another while they determine where they are on the bone to make the cuts. So I'm just gonna bring you to the tray here so you can kind of get an idea of everything over here in this compartment is for your femur. Everything on this side here is for the tibia. So I'm just going to go through and assemble instrumentation, but I also wanted to point out that on the nav unit, if you hit the center button to power it up, it kind of works as a surgical technique, a guide for you. So it'll kind of give you images showing you how the different instrumentation connects and kind of walks you through assembly of the instrumentation. So this does a quick self-check or self-test for the femoral components here, or the femoral aspect of the system. This is the microblock. You'll pull this piece out, and this post kind of free floats here. There's a notch on this post that we want to engage this gold tab around to lock it in suspension. So that will then be locked up in position. And sometimes you'll get this back from a previous case where this is, you know, kind of a little wonky from the last time. You just want to get it back to a neutral position. So if you use the white handled ball driver here, if you go halfway up on the screw heads or halfway up on these screws, you'll be about neutral. You just want, if you're looking at the jig from the side, parallel on the side, parallel on the top. Doesn't have to be exact, but halfway up on the screws will get you there. And then cutting block is down in the slot here. This is going to slide right onto the post that we just locked. There's an arrow on this post as well as an arrow on the block showing you how these guys pop together. That's your femoral jig. For the tibial jig, we're going to grab out this largest piece here, this one right next to it. It's going to slide up onto the post just as it was in the tray. So it's keyed to only fit one way, so you can't mess it up. Just slide it right up, and then there are 2 molecular probes. This straight one is going to get it done 95% of the time. In situations where you have a longer or a shorter tibia, we have this piece here that you can extend down for long or flip up for short. But as I said, this one is pretty much what you'll need most of the time. So you're going to press the round button on the side here. This piece will push all the way through. So everything, this is going to attach to the tibia, as you see here. So you just want everything to be on this side of the jig. So one more piece at the top. There's a midline probe. This is going to reference the ACL footprint. There's 2 prongs here. It's keyed to only fit in one way again. So this is a new instrument. You just pop it in there. And then there's a fixation arm here that's referencing laterality. So right side, left side, whichever it is, it's spring loaded. So you're just going to pull it out and flip it around the other direction, whichever way you're doing. And that's your tibial jig. So that's instrument assembly essentially. There's a few more pieces in this tray that you'll use: tibial cutting block and stylus. And then we already had the white handled screwdriver out for this. And then this piece here is a resection guide for the femur. Now I'm just going to go through kind of how it calibrates and assembles to the instrumentation, and then that's kind of it. This is a mounting bracket that the navigation unit attaches to, so I'm actually going to use this one because we're already set up. There's an arrow on the back of this, and the nav unit is kind of keyed to fit right up onto here. So you just want to slide this up from the bottom up. Doesn't really click or anything like that. You just push it all the way up firm, and it's in position. If you need to take this off of the bracket, if you push down on this arm towards the nav unit, it'll slide the navigation unit right off. So this will pop on. The sensor comes out of the tray. This guy is $4,000, so this does not get thrown away. This is something that you want to kind of be careful with. Don't put it in the bottom of the basin and have things kind of thrown on top of it. Just be a little careful with this computer. But it can be washed just the same as all other instruments are. So that sensor is going to attach right onto this bracket here. So these guys are going to stand up like field goal posts. I hit the center button, it ran through a self-check, so now it's giving you the option of knee or hip. We're going to select knee. The center button is kind of your next at all times, and then the left arrow will bring you back. So it's asking me to plug in a battery in the sensor. So you're just going to lift open this flap on the back. Positive will go on the left, It'll turn yellow when it powers, and then once it syncs to a sensor, it'll turn green. So now we're going to check the sensor number, 11150, 11150. It won't happen. Sometimes if there's another room going on, it may pick up another sensor. I've not really ever seen that, so you shouldn't be worried about it. But the nav, if it should not be that number, you would hit no, and it would continue to scan to find another sensor. So at this point, we'll hit yes. It's showing you an image of how to assemble it onto this bracket like we've done. Hit the center button again, and this is the 4-step calibration sequence. So you just want to get it on a Mayo, or excuse me, not a Mayo, a flat surface that's not moving. Just let it do its thing. Once it's in position, there's a little circle there and a green, kind of like a ball level type of thing. As long as it's meeting that and it's green, it'll advance. So just let it do its thing. Horizontal, vertical. You'll roll it on its left-hand side, and then back up to a 45-degree angle. So these two now know where they are relative to one another in space, and when they attach the instrumentation, they'll be tracking and moving with one another to determine where the bone is. So now on this screen, it's asking you proceed with gap balance calibration. That's another system that we don't have yet, so you're going to hit the skip button. It's showing you how to assemble the femoral jig, which we've done, tibial jig, which we've done, and then you can select left or right side. So I'm going to go ahead and go through the femoral side first, because that's how Dr. Sagal does his procedure, femur first, then tibia. So we are doing a right side, total, and then femur. So you'll just toggle between these up and down arrows. All right, so I'm just going to breeze through this part so you guys know kind of which instrument comes up next. But all of this comes in one construct like we did. So you're going to hand up a pin. Do you guys use our pins? I can't remember if we sent some in,
Yes,
right?
Tyler had me process them. I think they should be in individual peel packs now.
Okay, all right,
yeah,
perfect.
4 to a set. Is that correct?
Yes.
Yes.
Yep.
I don't know if they're in the living room yet, but I know that they're getting set up to do that.
Okay, awesome. So we have a pin driver that just hooks up to a modified Hudson. You can use a wire driver. These are 3.2 millimeter pins, so they fit on your normal workflow and setup. He'll place a pin here at the distal femur, kind of so you're no longer using the IM rod. We're not going up the canal like you're used to doing with conventional instruments. He'll place a pin kind of where that usually goes. This assembly will slide over top. And then you'll pass up 2 headed pins that will come from our set as well, and that'll give him nice rigid fixation to the bone here. And at that point, you're going to hand up both computers, so he'll attach these here and here, black and white dots to coordinate, and then he's going to move through the software. So we've already attached it. He's going to plug in a number here that's telling him kind of where it's assembled on the bone. The next thing he'll do is a quick range of motion. And this identifies center of rotation at the femoral head. And then between those 2 points, we know the patient's mechanical axis. So we use this ball driver here. That'll come up next, and he's going to make adjustments. So at any given point, as I mentioned, these 2 know where they are. So this one's stationary on the instrumentation. This one's attached to the cutting block. And as we make adjustments, these 2 are going to move apart from one another, and that's how the angles change. So he'll dial in what is appropriate for the patient. Flexion extension, varus valgus, all that good stuff. And then next, he'll pop these off, black and white buttons to remove. You'll hand up this depth guide or distal resection guide. This is going to slide over the post. And again, this is sort of your standard 9, 10, 11 millimeter resections distally. At that point, he's going to unlock this tab, and that'll release the assembly. And then you're going to hand up 2 headless pins, 2 long headless pins. And again, it could be with the implant company's pins, our pins. Dr. Sagal does like our threaded, definitely these shorter pins too. So you'll place 2 pins in this cutting block here, hang on to the wire driver or pin driver, and these first 3 pins will come off, and the assembly will pop off, and you'll be left with just your distal resection or your distal cut. So he'll make the cut, and then on the back table, you guys will be advancing the software here. So if you just hit the center button, that'll kind of move to the next screen, keep on going, press to continue. I'm actually going to switch legs here, left, total, and tibia. So this is all just kind of keep hitting the center button. It walks you right through what you've got to press and how to move through it. And then, so the tibial jig, you'll hand up. It's this piece all in one. It's kind of sort of like your standard extramedullary guide with a little bit of pizzazz. So this guy's going to come up. He's lining it up with the medial third of the tibial tubercle here, posterior ACL footprint here, 2 pins, 2 of the shorter headed pins, and then a calf strap for fixation. And then these sensors will come back up, and he's going to attach them onto the face of the jig, and then here off of the post. So again, this is all the stuff that he knows what to do with. So ACL, we've done that. Moving on, he's going to open these levers. He's going to match this number. So just like we told the femur where the instrumentation was assembled relative to this distal pin, we're doing the same thing here at proximal tibia. So this guy says 4.5. We draw this out to match. Lateral first. And some things that you guys can, look for. It's in a green zone, so it likes to operate in a particular plane. If the knee happened to be too extended or too far out, it's going to be orange and it's not going to advance. So sometimes the knee itself just needs to be positioned in a 90. So you'll register lateral first. Come around, same thing for medial. So now we know where the leg is in space, and as we move this medial and lateral, our varus valgus values change. We'll lock this into position with what we like. Same with slope. This is adjusted here. This gets locked down. So now angles are set. We pull this ACL probe up proximally. Cutting block slips right in here, and stylus. So this is kind of stuff that you guys are used to seeing, and he'll get this in position, drop it down, 2 pins in the block, and he can take these off at that point, and then he'll make his resection for the tibia. And then you're done with us. You're just back to the standard instrumentation with whatever implant company, your sizing guide, 4-in-1 chamfers, all of that is like usual. Any questions?
All right.
I know, it was like a